Well, welcome everyone. We are so excited about our meet and greet today. This is your opportunity to meet your coach mentors, hospital teams to get to know each other. And this is something new we're trying with the Prompt Initiative. So next slide. I'm just going to go over the agenda for today. We, of course, will be doing a nice welcome. I'm going to be introducing the coach mentors. So if I get somebody's name wrong, just please feel free to speak up and say, can you go back to the agenda again? Please chime in if I say something wrong about you. And I'm going to quickly go through the hospital groupings just to remind everyone where they belong and a foundation for our coaching calls. We'll briefly go over February's agenda, but that will be something in your rooms that your coach mentor will reinforce. And we're going to touch on our mentoring meetings. We really want to talk that up this time with our Prompt Initiative, that when you meet all these coach mentors, you're going to realize what top of the line people we have out there to help you. And then we'll break out into rooms and then come back to the main room after. So with that, I will introduce, first of all, the FPQC team. We have a great team, and each and every one of them want to welcome you here today for the Prompt Initiative. We have 4 clinical leads. I am the nurse on the team, and we have 3 physicians. Dr. Cole Greaves, you probably know him. He has been active with ACOG. He was the district chair, and he is at Winnie Palmer, and he is a perinatologist. Daniela Cruzalot. Daniela, you can wave because I saw you out there. She is a physician with an expertise in women and heart health. So she heads up the heart program there at Women's Heart Program at Tampa General Hospital. And then her colleague, Dr. Ashley Kane, is also another MFM at Tampa General. So she, another co-lead there with us. Our family lead is on today, and Mandy, if you just want to wave to everybody, Mandy is who you met at the kickoff. So she is a patient experience and will be on many of the coaching calls. Our executive director is Lori Reeves. Of course, we couldn't do anything without Lori, and Linda keeps everybody on track. She is our associate director there, and Stephanie Rubio is also our director who handles the data. She's an epidemiologist and a physician by background and training. Our QI team, I know y'all know, is Stephanie. She's out there. And Sarah. Sarah's been the one responsible for coordinating this all and getting us today. She'll be getting us into our rooms, hopefully smoothly as we did on Wednesday. Last but not least, our data team that works so closely with the Stephania. We have Shelby and Alexa. So Shelby Davenport and Alexa Muchler, they are both out there and happy to help you as we move along. So on our next slide, we have basically just to remind you all of our initiatives, the maternal health. We just wrapped up mother focused care. And this is the prompt. And we will be launching OB hemorrhage coming up. April 16th will be the kickoff. We also have infant health initiatives. I know I see lots of you on those calls as well. The perinatal quality QI indicators is another initiative that does count, just as a reminder, as one of the 2 required participations with FPQC. So thank you for that. Next slide. This is the state of Florida. Isn't it impressive? 91 prompt hospitals out of 104 birthing hospitals in Florida. So that covers 91% of the births in Florida. We now have active with prompt. Next slide. And we are so excited about these teams. What we did is we put people into common teams and also teams that were on the last initiative. We tried to keep people together as we have been building momentum around our initiatives. So first of all, I will introduce everyone. And if I get something wrong, you can just speak up. Nadine Walker is Executive Director for Advent Health over 8 of the Central Florida campuses. And her partner, physician partner, is Rohana Motley, and she is an OBGYN hospitalist at Advent Health Winter Park. She was on Wednesday. I'm not sure that I see her yet. Ascension Bay Care Hospitals, you are going to be covered by with Shamika Greenidge. Shamika is right there. And Shamika is a director of quality there at Women's Health Quality at Lee Health. And she is also 6 Sigma Black Belt, all that good quality characteristics. Dr. Andrea Friel. Andrea has been with us on the last initiative, highly experienced OBGYN who's also very active with ACOG. Baptist Health Hospital Systems. We put you all together, and your coach mentor, your nurse, is Danielle Moore, who's a clinical specialist at Lakeland Regional Hospital, and Dr. Ira Seitz, who's an OBGYN there at the Bay Care System. For HCA, I did the best I could on dividing HCAs up into 2 groups. If you find that we put you in the wrong group of HCAs, just let us know and we can easily switch you. But for the HCA East hospitals, we have Rosalina Maller. She is a clinical specialist there at Kendall, HCA Kendall Hospital near Miami. And Dr. Adolfo Gonzalez Garcia is another perinatologist. He is the medical director there for the Perinatology Premier Associates there in Margate, Florida, and covers a couple of the HCA hospitals in that area. Next, for the HCA West and North hospitals, that is going to be Carol Lawrence, who is a professor now at Florida Gulf Coast. She is a PhD prepared nurse, and her dyad partner is Dr. Julie DeCesar, who is an OBGYN, now District 12 ACOG chair. Thank you for being here, and heads up the residency program. So those two have worked together with PAC. So you're going to have a great group there as well. Holmes, Jupiter, Lakeland Regional, Lakewood Ranch, Manatee, Lee, and Jackson. That is a large group. Also, Tricia Walton is a new coach mentor with us. Most of you know Tricia from A1. She has over 30 years of experience, high-risk perinatal nursing experience, and is now faculty at HCC and adjunct at USF, College of Nursing. And her dyad partner is Daniela Cruzalot. I introduced her before as being one of the co-leads, but again, a lot of expertise as a physician around cardiac and women's heart health. Okay, next, Tenet Community Health Systems from Palmetto. That's Pat Durant, who is another nurse with over 40 years of experience, very active with A1 and FPQC. She's on today, and her dyad partner is Alyssa Brown, OBGYN at Tampa General. She is the medical director there for the OB division. I'm not sure if she'll be on. She was on Wednesday. Sarasota Memorial Hospital's Broward Memorial and Jackson's, that is led by Dr. Bridget Funk, who is a PhD prepared nurse, heads the quality there at Sarasota Memorial. And John Caravella is an OBGYN, OB hospitalist in the Broward area. And I believe he is right now, I saw him earlier today, he's in L&D, so he may not be able to get on. TGH, TMH, NCH, Cleveland Clinics, Parish, and Mount Sinai is all being covered by Lindsay Greenfield, who is another quality specialist. She is from Tampa General, and I believe this is her 4th initiative with us as a coach mentor. So she brings a ton of experience. And Ashley Kane, again, perinatologist I introduced before, will be her dyad partner. Okay, from Orlando Health, just Cole and I. So I've already introduced us. And next slide, please. So with the coaching calls, we want to set the foundation early on. Your coach mentors will reinforce this, but we know to earn stars is important to everyone. We know you can't make every meeting, but you need to attend the majority and also present one QI tool every quarter. So your coach mentors are going to help map out who's going to present when. And this can be a PDSA, a Gemba, different quality improvement tools once every quarter. The other thing that coach mentors ask that I reinforce is that we would like to have clinicians representing each hospital on each coaching call. Of course, corporate level people are more than welcome, but we don't want to have one corporate person representing 3 or 4 hospitals. So someone clinically also on the calls would be great. And we are going to try a little PDSA here on our first coaching calls in February. So when we do roll call, we would like to have one person from every hospital do an audio visual check that hopefully will encourage people to have their cameras on so we can have better participation, although it's been outstanding throughout our initiatives. And again, we want you to participate and give us feedback. So next slide. We are going to share with you your coaching call agenda. In the chat, I put in a 30, 60, 90-day plan. That's something that we would like for every hospital to have ready to go in February. It's very easy. It's a fillable form that I put in the chat there. So your first call, you're going to have another nice welcome, getting to know each other, and hospitals getting to know each other as well as your coach mentors. but then also that 30, 60, 90-day plan. Your PDSAs won't start until March. So your coach mentor will discuss with you how those are going to be happening. And then we always put data at the beginning of the calls, but Dr. Rubio suggested we put it near the end because we've had a lot of data calls already for prompt and it creates a lot of dialogue. So we'll put that at the end. And that's the February coaching call. And always we like your feedback at the end of every call.